Welcome to this video on the psychological effect of disaster on displaced populations and refugees. I'm Dr. Nasser Hassan, an EM consultant specializing in disaster mental health. We are looking at the humanitarian landscape, a global crisis of displacement. We must understand the psychological toll in environments marked by extreme deprivation and instability. Refugee trauma is a multiphasic sequence, creating a cumulative traumatic load. This includes trauma pre-migration, peri-migration during the perilous journey, and post-migration, facing life in camps and cultural isolation. Acute psychological responses include acute stress disorder, characterized by dissociation and hyperarousal within the first month. Grief is often complicated by the inability to perform traditional burial rites. Many displaced populations present with somatic symptoms that mask their psychological trauma. Post-traumatic stress disorder is highly prevalent, reaching up to 40 to 60% in specific displaced groups. Manifestations include intrusive flashbacks, avoidance of triggers, negative alterations in mood, and hypervigilance. Prevalence data from camp-based populations indicates high rates of mental health issues. PTSD is estimated at 52%, depression at 44%, anxiety disorders at 38%, and substance abuse at 15%. Vulnerable groups face unique challenges. Children are at risk of toxic stress, affecting neurodevelopment. The elderly face high rates of depression and isolation. Women face unique risks of gender-based violence and the burden of caregiving. The ketone management framework prioritizes safety and stabilization. No psychological healing can occur without physical security. This involves ensuring safety, restoring daily functions, and early psychological screening. Systemic challenges create significant barriers to effective intervention. These include a 70% lack of professional translators, a mental health professional-to-patient ratio of 1 to 10,000, and 45% of people avoiding care due to stigma. The principles of psychological first aid, or PFA, are essential. They include look, listen, and link, checking for needs, approaching people to calm them, and helping them access basic services and information. We must remember that the displaced are not defined by their trauma, but by their incredible capacity for resilience in the face of absolute loss. Thank you for watching this video. If you have any further inquiries, please feel free to reach out to me, Dr. Nasser Hassan, EM consultant. This final slide lists the sources for the images used in this video.